Hello. In this lecture, we're going to talk about radiographic interpretation. And very simply, interpretation is just the ability to read a radiograph or an x-ray, just to be able to look at it, know what you're looking at, see what's normal, see what's abnormal, just to read it. And some terminology that goes with that is a preliminary diagnosis, and that's made by the auxiliary. It's made by the hygienist and the assistants. As you take the radiograph, you're going to look at it, and you're going to look at the image, look at the quality of the image, and from that, you'll be able to pick out certain things that maybe you need to mention to the dentist, or mention that, hey, this has some errors in it, and it may need to be retaken. So there are just some, different things that could fall into that preliminary diagnosis, but it's made by the auxiliary to the dentist. The auxiliary in most states are not allowed legally to make a final diagnosis to the patient. The final diagnosis has to be made by the dentist, and it's the dentist who's informing the patient. And so that's just kind of some differentiation. And again, auxiliary can make that preliminary diagnosis, but the final diagnosis has to be made by the dentist. And that means that the dentist is the one telling the patient, not the auxiliary. And that can get kind of awkward sometimes. And just some ways to work around patients asking, because if you take a radiograph, the first thing that the patient's going to ask is, well, do you see any cavities? And the easy way around that is just to say, well, the dentist is going to come take a look at these when we're done. I'm going to go ahead and get you cleaned up so we can get you ready for the dentist to come take a look. Or I'm going to go ahead and get everything set up so the dentist can come take a look. But just make sure that the patient knows that it's not that you don't see anything, because you don't want to say, well, I don't see anything, but the dentist will come take a look later. Because if the dentist comes in and finds 5 cavities and you just told the patient I didn't see anything, just kind of be careful there. Or that could go the other way. You say that you have a bunch of cavities and you tell the patient they have a bunch of cavities, but the dentist will come take a look and do a final diagnosis. Then the dentist comes in and they take a quick look and say, well, no cavities, you're good to go. Well, then the patient's going to wonder, well, did they just not take time to do a thorough exam? So any findings that you see, you're going to tell that patient that the dentist will make the final diagnosis. You can mention things to the dentist, you just can't tell the patient. Okay, some more important definitions, and they kind of come in pairs. You've got radiolucent and radiopaque. Radiolucent is going to be your darker or your black areas on a radiograph. So if you think about looking at that black and white picture, those dark areas, the black areas, those really dark grays, those are going to be your radiolucent. Radiopaque is going to be your white or lighter areas, or the lighter grays in that black and white picture. Density and contrast kind of go together also. Density is the overall blackness of the film or the image. So when you're looking at the radiograph, you can look at it and say, well, it's either a really dark image or it's kind of washed out and really, really light. That's talking about the density. And something we're going to talk about later on in the semester, but just kind of something to put in here while we're talking about density, just so that you kind of lock the things together. Energy equals blackness. So anywhere that energy touched that film or touched that sensor to create the image, anywhere that energy touched it is going to equal blackness or darkness or a very dense area that's radiolucent. Okay, so if an image is completely dark, that means a lot of energy hit it, or there was nothing in the way to block the energy from hitting it. So just kind of keep that in mind, and we'll talk about some more specific things later in the semester. Contrast is talking about the different shades of gray present in the image. So when you're talking about contrast, you're not talking about the overall big picture, the whole image is dark. That's density. With contrast, you're talking about the different shades of gray within that black and white image. So you can have low contrast or high contrast. Low contrast means that there's not a lot of difference between your shades of gray, which means that you're going to have a lot more of them because you're going from completely radiolucent to completely radiopaque in most cases. So low contrast, not having a lot of differences in the shades, means there's going to be a lot more shades of gray, before you get from radiolucent to radiopaque. It's like taking those tiny little steps when you're in a theater or something. Those tiny little steps, but you're still going to have to get from the bottom to the top. Okay? High contrast means that you have a lot more difference between the shades of gray. So it's like those really big concrete steps you have at a park maybe, where they're just really big steps. Well, that's high contrast. It's mostly white and black with a few shades of gray in between, so that going from that completely radiolucent to completely radiopaque is a much bigger step. Okay? Another term that's kind of related to that is scale of contrast. It's a little different than contrast, but when you're talking about the scale of contrast, you've actually taken each individual color, each individual gray, you've pulled it out and lined it up from lightest to darkest or darkest to lightest. So you're making a scale out of it. Okay? Low contrast means that it's not going to have a lot of difference. The grays are going to be very similar to each other when you lay them out, and so it's going to make a long scale of contrast. It's going to make a long set of steps. Okay, and I've got some images in a minute that I'll show you. But low contrast means there's not a lot of difference, which means there's going to be a lot of steps to get from radiolucent to radiopaque. That makes a long scale. Okay, and for now, and we'll talk about KVP later, but just so that they're always together, you learned these terms together. You've got low contrast equals a long scale of contrast, and that's created with a higher KVP. Okay? And then you have high contrast, which again, remember that means there's not a lot of there's a lot of difference between the steps and there's not as many steps. Okay? So high contrast, you're going to have a shorter scale because the steps are much bigger to get you from radiolucent to radiopaque. And that short scale of contrast is created with a lower KVP. Now, I know KVP doesn't mean anything to you right now, but it will, and I just want these to have always been learned together. I thought this was a fun little statistic. I've seen various numbers here, but the human eye can only distinguish 32 shades of gray, and we're going to go through all of them in radiology. We're going to learn them all and see them all. It's a matter of training your eye to be able to read and interpret these radiographs, and we're going to have some little practice things at the end of this slideshow. Okay, so to kind of start getting your eyes trained, I want to just show you just some different things in a radiograph. This is what's called dental materials. These are materials that are used to fill cavities or correct different dental disorders. So I want to just kind of show you these and what they look like. Here we can see that those are teeth. And you can see the filling here. And you see how much brighter radiopaque that is? That's because it's actually metal. Metal is going to block more x-rays than the natural tooth structures did. And so that metal blocked more x-rays. Remember, energy equals blackness. So this part of the image got exposed to a lot more x-ray. This part of the image got exposed to a lot more x-ray because it's darker. This part with the white filling, the radiopaque filling, that didn't get hit with very many x-rays because the metal blocked it. It was more dense. The more dense a structure is, the more it's going to block x-rays. Okay, we're going to talk about anatomy later, but I just wanted to show you. You can see the different structures within the tooth. You can see the bone. You can see the dentin here and the enamel here. You can see the nerve space here, the pulp chamber. Okay, this is the top edge of that bone that's holding in the teeth. You can see the structures of the tooth. The difference in the density of the structure is why it shows up different radiopaque values on the image. Okay, then just for fun, see this little spike sticking up right here? Okay, that little spike sticking out from that molar is actually a piece of calculus. That's the buildup that we scale off and clean when we're cleaning people's teeth. Okay, we're going to drop down to this slide. And again, you can see the different structures. Okay, this is the nerve space or the pulp chamber. You've got the dentin here. You can clearly see that enamel here. And then you can just kind of see the different shapes of the teeth. This one isn't as clear, just kind of has a different look to it. That's probably a composite, which is a tooth colored filling. But then here you can clearly see that that's metal. Okay, that's going to be a probably a crown, maybe a really large filling. But then you see these little posts that are sticking out. Those are actually retention pins. The filling, when they did it, they had to take out so much of the tooth structure. They were afraid that the filling itself wouldn't stay on very well. So they actually drill these little holes, put the retention pins in, and then build the filling around it so that it'll kind of retain and hold the filling in a little bit better. And they're actually missing a tooth right here. That's why that space is there. Okay, here we've got just some more stuff going on. This is another composite. It's just a tooth colored filling. That's kind of a resin or plastic type of a material. And you can clearly see all this metal. Okay, this is a filling. You can see where they've had root canal treatment done. This is a filling as well with a root canal treatment. This is a crown, and the only way I can really explain how you tell the difference in those is that this has these nice, clean, perfect little edges because it was actually made in a lab. Okay, same thing here. Nice, clean, crisp edges. This doesn't have clean, crisp edges because it wasn't molded and formed in a lab. It was actually made chairside doing a filling. And you can see more root canal treatments on all of these teeth. You've got another retention pin, just like the ones that were up here. You've got another one right here. And this is actually a little bitty piece, probably of this filling, that broke off, and it's either floating loose or it may have gotten embedded in the patient's cheek. That happens sometimes. Okay, this is the same patient, just a different year. And the image is just a little different. It's got a different density to it, and that little piece isn't there. So whatever that is new from 1985 to 90. Okay. I put this image in because I wanted you to see and understand that there's two different kinds of composite. The older material that's just not used as much anymore actually looked like a cavity when they put it in because it's just that tooth colored plastic, type material. So when they put it in, it matched the tooth and it looked great. But then when they take x-rays, it kind of, looks like it could be a cavity. That little notched out dark area looks very much like a cavity, and I'll show you some more of those in a minute. But they went in later and they added a radiopaque material to the composite material so that it looks more like this. It looks more like this. So it doesn't look like a cavity, and so that when you get a decay or cavity underneath it, you can see it because it's a different colored material. It's not going to look like decay already, and then you get decay underneath it and you can't see that there's decay there. Okay, this is another crown that was made in a lab, and you can see the nice, perfect little edges to it. So that wasn't made chairside. This was made chairside. This is what fillings look like on an x-ray. Okay, this is a bad filling made on an x-ray, but this is a bad filling. It's got some rough edges to it, rough margins, but these were all made chairside. This was made in a lab, and you just kind of see the difference. But it's called a porcelain fused to metal crown. The porcelain is up here, and it looks very, very tooth-like. It looks like these same structures because this enamel and this porcelain are very similar density. But then you've got that metal prefab base, but metal formed base underneath it. And this tooth also has some root canal treatments done to it. And you see these little fragments again. These little fragments, if they are embedded in the soft tissue, it's actually called an amalgam tattoo because the amalgam restoration, little bits of that metal get embedded in the tissue, and it almost discolors the tissue to like a blue, dark blue color. And so it's called amalgam tattoo, and if you're not sure if that's what it is, you take a radiograph, and sure enough, you can see the little metal fragments that are in there. Okay, this is kind of fun. These are implants, and I just want to kind of show you the different stages and just kind of what they looked like. But you can see in this first image that this tooth is actually an implant. It has the crown on the top. It's attached to the little piece here. Then it's attached to the actual implant itself. And there's a significant amount of bone loss here, so that's probably why the person lost this original tooth. It's also possible with that much bone loss that they just were congenitally missing that tooth, and so the bone just kind of resorbed since there was nothing there to hold it. The one next to it, this is a porcelain fused to metal crown, just like the one on top of the implant, but this is actually a retention post as part of root canal treatment. Do you see the outline of the root that's still there? This is not an implant, and the reason I love that they're side by side like that, because quick look, you might think this is an implant, but you can still see the root of the tooth intact. So this is actually still a natural tooth. It just has a porcelain fused to metal crown with that retention post. That's actually probably file from the endodontic treatment, but that is still a tooth. This is the implant. Over to the middle, you can see these 3 implants that have very recently been placed. They actually don't have the crown on top yet. Okay, they kind of look like little tiki torches or aliens or something, but they're just sitting there. They're probably actually under soft tissue with the tissue stitched across, because it takes a good 6 months before the bone has completely fused to these implants and they can support the weight of the crown. So you'll see these for probably about 6 months. Again, the soft tissue may even be stitched up across the top to keep it from getting infected and just to let it heal and fuse. Once that time has passed, the patient comes back in and they put the little piece on like this. They make sure that this little piece fits on. They take an impression so that they can make the crown. Okay, so that's just kind of the steps that go along with it. Once this little abutment piece is in, they make that impression, and it's, from then on, this is the exact same steps that they would make a crown over a natural tooth. But just some different examples. Here is actually a bridge. This is a natural tooth. There's a tooth missing here. These teeth were missing, but they've replaced them with implants. So they've actually made a 4-unit bridge with a natural tooth as the abutment on one end and 2 implants as the abutment on the other. Okay, you've got another implant here. This is a very large amalgam filling that actually has some decay underneath it. And then same thing here, very large amalgam filling with some decay. Okay, this tooth could not look more natural. It's actually a very well done implant, because here's the x-ray of it. Okay, so if you were talking to this person, you'd never know that wasn't a natural tooth, but it's actually an implant. These are also implants, and then there are the radiographs of them. So it's just really interesting. Implants are probably not something you've seen a lot of so far, so I just wanted to include those just to be something interesting and different. These are actually some examples of a full mouth rehabilitation, just kind of while we were on the implant kick. This is the patient's before picture section. All of these are the before pictures, and then these are all of the after pictures. So you've got just the intraoral facial view. This is the panoramic of the before, and you can see they had these 3 teeth. They had 2 natural teeth with no restorations on them, and then several teeth here. On the bottom, they had 1, 2, 3, 4, 5, 6, 7. Looks like 7 teeth total on the bottom. So when they were done, all of the top teeth are gone. So they've extracted all of these, replaced them with several implants. So you've got 4, 5, 6, 7, 8, 9, 10, and they're kind of attached at different places. So this little free-floating little edge over here is a cantilever bridge. He's actually attached to this one. And probably, if I had to guess, this is attached from the midline all the way back, and then same thing here, midline all the way back. That these are all fused and connected. These are all fused and connected, but there could be spaces anywhere in between. On the bottom, they did save 5 of the teeth. You've got these 2 and these 3. They crowned those and then just incorporated them with the rest of the implants when they finished up the full mouth. But anyway, those are just some pictures. I think it's a fantastic job that they've done. they have invested a lot of money. This person probably won the lottery to afford something like that. That's crazy. Okay, there's different kinds of implants, so I just wanted to give you some just different perspective on those. This patient had full mouth rehabilitation done because he had throat cancer and oral cancer. You can see kind of the scarring of that. So this is probably where they've had some surgery, taken out lymph nodes. You can see where there's a lot of bone loss just from that surgery. And this is the after picture of his implants with the dentures. So you can kind of see they've pulled his cheeks way back. Otherwise, you normally would not be able to see this when he smiles. But you've got these posts. You can see 4 posts on the bottom, 4 posts on the top. Those posts are actually connected to a frame. So the frame looks something like this. You've got the implants that are down into the bone, kind of holding everything. These little chains that you see going through here, those are really common when you have someone who's had a car wreck or something like that. But in this case, they've had reconstructive surgery. But these little chains are actually used to hold pieces of bone together. And sometimes it's little small sections, sometimes it's big sections. And each of the little spaces that you see that is where you see a solid hole, that's actually screws. Where you see the empty ones, those are just the little empty chain links. Okay, so that's just kind of a picture of before. Not necessarily the same person, but a picture of before. And then this is after. So you've got this frame. Remember the radiograph of the 4 posts kind of sticking down. And you've got these little buttons that stick up. And the denture just snaps onto those. And so you've got the denture snapped onto, so it's locked into place onto that framework of the implants. It's just a different type of implant. I wanted to make sure you had seen both. Okay, just some different fun things that you don't see a lot of in traditional radiographs. You want to be able to see all of it in a radiology class. But you can see right here, see this little shadow? What's happened here is they've had a lot of bone loss. The bone should come down and attach to the tooth about right here. So it should be about here, even with the rest of it. But they've lost a lot of bone, and probably 10-12 millimeters of bone. So that's significant, and they may end up losing this tooth if they don't do something about it. So what they've done is they've gone in, and you can see how this is a little more radiopaque. It's a little bit brighter right here. Okay, when bone heals, the bone is going to heal a little more radiopaque because it's a little more dense than it naturally would have been. In this case, it's bone grafting, and since it's bone grafted, it's artificial bone or natural bone from a donor that's taken and packed into the area that you need the grafting placed. And so it's just a little more radiopaque, and you can see now it comes and attaches to the tooth much higher, and they filled in this space. Okay, so these are the radiographs. Here is obviously not the same tooth, but here is a similar little void to this bone loss here, and they've gone in with bone grafting and packed in and filled the hole just like they did here. Okay, just some fun, interesting things. We want to make sure you see it all. Not necessarily in this first day, but we want to make sure you see it all. So this is actually a piece of film. You guys will be using sensors, and so they have cords on them, thank goodness, because apparently people actually can swallow film. I didn't think that was actually a thing, but this guy has actually swallowed a piece of film and had to go to the emergency room and have that x-rayed. This is a baby tooth that has not fallen out yet. It has a little amalgam filling in it. So you've got the crown of the baby tooth here with the permanent premolar coming in underneath it. And so this person actually has all of these premolars with one last baby tooth to fall out. And he's hanging on to it for dear life. This one's a little blurry. This is a very old digital image. So if you ever see something that's really pixelated like that, it's probably just really old. But these are acrylic crowns. There's root canal treatment done. You can see those retention pins in there. It's just a bad quality image. This image has what looks like a very small burr. That's a round burr, which is what they would use to drill and work on a tooth and get it prepared for a filling. They could have been working on this amalgam, trying to prep it to have a crown done, something like that. And it looks like it slipped. Now that looks really dramatic. It looks like it slipped and is buried into the bone. It's probably not. It's probably in soft tissue. That doesn't make it feel any better. It doesn't make it any less ouch. Okay. So this image in the middle at the bottom, what you're looking at there is actually two teeth that are is one tooth trying to split into two teeth, I guess is a better way to say it. So it's called gemination. You have one tooth that, as it was developing, tried to split into two. So it's called twinning. It's the same way that twins are formed, where you start out with one and it starts to divide as it develops. So that happens in teeth as well. And had it completely finished separating, you would have had an extra tooth. But it didn't, so you've got a tooth that is a geminated tooth. Okay, what I'm showing you in this image is this bent, angled root. Sometimes that just kind of happens during development. You see it a lot with patients who've had braces. Their roots will be kind of angled in different directions because of the movement from braces. But it's called dilaceration, especially when it happens naturally. It's called dilaceration. And that just means that the tooth has got an angled root, or it bends in a 90 degree. Okay, some different pathology. I told you we would look at some cavities. All these little red arrows are pointing at either cavities or decay. Here. Okay, here's some bone loss in this image and some bone loss in this image. And then here in the middle is actually showing you an abscess. So you've got an abscess tooth, and it has worked its way up through the pulp and inflamed the pulp, and you can actually see the inflammation through the enamel here. Okay, so just some different images showing you just different things. What I want to point out to you is whether it's decay or caries or cavity, just depending on the term you want to use. Okay, you've got caries or cavity here, here, and here. Okay, that just means that part of the tooth structure is gone and a cavity has formed. You've got bone loss here, which means you're starting to get periodontal disease, and you could end up losing the tooth because the support structure is gone, but you're losing that supportive bone. Or the tooth has, for some reason, become infected, and the actual apex root of the tooth has gotten an abscess around it, and that abscess is actually infection that's eating away the bone at the tip of the root. All of these, you're losing some type of structure. Either you're losing bone or you're losing part of that tooth or enamel. So when you start to lose calcified structure, it's going to show up as a radiolucent area. So in this case, you've got a radiopaque tooth. This is radiopaque dentin with a radiolucent cavity here. Radiopaque enamel and radiopaque dentin with a radiolucent cavity. Okay, same thing. Radiopaque bone, radiolucent bone loss. Okay, radiopaque bone, radiolucent abscess. Okay, so when you lose that solid calcified structure, the radiopaque area becomes radiolucent. Okay, so just kind of a definition of caries. It's loss of structure, and its caries will appear radiolucent in a radiopaque enamel or dentin. And just kind of some terminology to go with that. Incipient lesions means that the cavity started to form and then remineralized. So you may see something on the surface of the tooth, but it remineralized. So in a radiograph, it's either going to look the same as the other structures around it, or it may even look a little more radiopaque. Recurrent caries or secondary caries means that the person had a cavity, they had a filling done to get rid of the cavity, and now they have a cavity around or caries around that restoration. Okay, and then rampant decay just means that they have caries or cavities on several teeth all throughout their mouth. That's why it's rampant. It's decay all over their mouth. Okay. When you're talking about radiographs, there's no substitute for a clinical exam. You can't just do radiographs and not look in their mouth, but you can't do a clinical exam and not look at the radiographs. You need both of them to get the full picture. Small occlusal cavities or decay won't be visible on a radiograph because the enamel is so thick and so dense that a small little radiolucency isn't going to show up. Interproximal decay is not visible clinically. So when you're looking in the patient's mouth clinically, you can't see what's going on between the teeth where the surfaces are touching each other. But on a radiograph, you can see in between the teeth. Okay, this is rampant caries. This is just cavities literally everywhere. There's cavities all over. You've got the radiolucency here. It kind of goes to here. There's another one. Here. They've actually lost the whole crown on those two teeth. Okay, this is that same guy. Little decay here. Lost another crown here. Looks like some decay here. Definitely there. This guy looks okay. I think that one tooth is okay. This one, maybe. Got a little shadow there. Not sure. But you've got a large cavity here, little one here and here. You can see it better on this image. Okay, you got cavity here, all the way around, here. Now you're starting to see some radiolucencies at the apex. That means that those teeth are abscessed. There's actually one here also and here. Okay, going on around. Hard to tell, maybe something going on there and definitely something going on there. So out of every tooth this person has, there's literally one tooth maybe. I think that one's okay. That's rampant caries. This is a panoramic image. It's not super clear. I've got some better examples of these later. But a panoramic just shows you an entire picture of everything. You've got the TMJ joints. You've got the hard palate. We'll go through the anatomy of all of these later. But I just wanted you to see that the panoramic, what's different is it's a whole picture. It's just not going to show you the same amount of detail. Okay. Mixed dentition is another term that you'll need to know. Mixed dentition just means that they have a combination of permanent teeth and primary teeth. So they have their permanent dentition and their primary dentition kind of at the same time. So these are all permanent teeth in the center. Okay, the permanent teeth have already come in the center. These molars are permanent here and here. These are permanent, but they're not even in the mouth yet. Okay. But then you can see these permanent teeth underneath waiting to come in and erupt, and they still have the primary teeth up above. Okay, that's your mixed dentition. Okay, something else that you can see on a radiograph that's very common is called tori. You can have it in the roof of your mouth, or you can have it in the floor of your mouth. When it's in the roof of the mouth, it's usually smack in the center. When it's in the floor of the mouth, it's actually going to be kind of in that first molar area. It's just a little excess bone that develops, and you can actually see it on the radiographs as a little bit more radiopaque of an area because it's extra bone. And since it's a little more extra bone, the bone's a little more dense there, so it shows up as radiopaque. Typically, there's nothing that they would do unless they needed to make a denture or something for this person. They could go in, cut the gum tissue off, recontour this, and then stitch it back up. But rarely would they do that unless there was like some reason that it was bothering the patient. Okay, so what is going on here? We can see the teeth, we can see the roots, we can see the bone, everything we've been talking about, but these teeth just look kind of funny. They look a little wonky. It's because they're dog teeth. They take x-rays of animals' teeth also, whether it's dogs and cats at your local vet or if you're at the zoo. They actually have to, as part of the physical, check the animals' teeth at the zoo as well. So not all dental x-rays are going to be of people. So that was kind of fun to add in. These are just some kind of different things to see. This is a tooth they've done a crown prep on. Now they've put a liner over it. That's why it kind of almost like a jellyfish. They've put a liner over it that's just showing up a little different level of radiopaque. They've done the root canal treatment on them. Okay, now they're placing the crown and bridge combination here just to kind of get that bridge in place. You can still see the endodontic treatment that they did there, and this is the finished product. I just thought it was interesting. There are also a couple of optical illusions when you're talking about radiopaque and radiolucent. The first one is called the match band effect. Match band effect is just talking about when you have really radiopaque structures and it makes something else look radiolucent. So in this case, you've got this really large amalgam, which looks really radiopaque. Then you've got the root with the bone over here, which really looks radiopaque. So in the center, it almost makes it look like there's a shadow that could be decay. It's not, it's just this looks radiolucent because the rest of it around it is so radiopaque. It's like when you walk into a room and you've been outside where the sun is really bright, and then you walk into a room and it looks dark. Well, it may not really be dark, it's just that your eyes haven't adjusted yet, and it makes it look dark for just a minute or two. Same thing here. It's so bright above and below that it makes this look dark. Okay? Now, over here, this is an error called overlapping, and you can kind of see the little football-shaped radiopaque area on each of these. Well, what we're looking at is because this is really super radiopaque because it is 2 layers of enamel overlapped. And then you've got the enamel right next to it of the individual teeth. Do you see the little line that kind of outlines? When I say it looks like a football, it's because there is actually an edge to it, and the edge looks radiolucent. It looks dark, especially right here. Okay, that's an optical illusion. There isn't a dark edge. It's just that the radiopaque is so intensely white, it makes the edge of it look dark. So there's not a cavity there. That's just an optical illusion. Now, something to be careful of, here you can see that these teeth, kind of cut off and they look really short. Well, look at the teeth clinically. There's nothing wrong with this radiographic image. Those teeth really are that short. But if you don't look at the radiograph and look at the patient's mouth clinically, you wouldn't necessarily know, and you might think that this was an error. Okay? Now, cervical burnout is also very common. Cervical burnout is just kind of like we explained with the match band effect there. The cervical burnout is specifically at the cervical third or the cervical area of the tooth. Again, that enamel, and even when there's restorations in there, but the enamel is so radiopaque, the bone is so radiopaque, the cervical third of the tooth is the kind of the thinnest area. It's like the waistline, and it is really thin. It looks like there's shadows there that really aren't decay. There's nothing wrong with the tooth, and you can see it a little better here. These little notched out areas at the interproximal of each tooth, there's nothing wrong with these teeth. All those little shadows are optical illusions because this is so radiopaque and that bone is so radiopaque that that little thin area between them looks radiolucent. Okay, now over here, can you see that this looks different? Okay, this is actually abfraction or toothbrush abrasion. There's actually tooth missing here. This actually goes all the way across the facial of the tooth, and there's tooth structure missing. So you can see that looks a little different than this. This is just kind of notched at those edges instead of going all the way across like this guy does. Okay, now I'm not going to go through each of these. I'm going to leave these in the PowerPoints. I just thought this was kind of a fun little quiz game thing to help train your eye. You've got different colored categories. Red means that it's an incipient caries. Blue means that it's a moderate caries. Green is advanced, and yellow is severe. So as you're looking at these images, the first image to pop up is just a plain radiographic image. Look at it, study it really well. See if you see anything that looks off or odd. And then if you click to the next slide, it's actually going to show you what you were supposed to be looking at. Okay? Then you can go back and look at the original image beside it and see if you can see it. And this is just how we're going to start training our eyes to see these things. So the next image, you'll look at this one, see what you see, and then click to the next slide to see if you saw everything that was there that you were intended to. So I'm not going to go through all of these. You can go through them. But like I said, it'll help to train your eye to see those difference in the shades, the difference in the densities, and it'll help you spot caries a little easier. But again, preliminary diagnosis. You'll see what you see and you tell the dentist, and then the dentist will tell the patient. Thank you.